Hello, everyone. My name is Juan Espinosa, Director of Student Success here at the UCLA School of Nursing. Thank you for joining us today for our Spring Quarter Alumni Panel. We have 7 alumni who are donating their time to be with us here. So we're very excited to have them. Let's go around for introductions. How about we do on Zoom first? Dr. Ensawen?
Hi, can you hear me, Juan?
Yeah,
Great. Thank you for having me. My name is Ensa Esposito Wen, and I am an alum from the class of 2004. And in that year, I graduated with a double master's as an adult nurse practitioner and adult clinical nurse specialist. At that time, UCLA did have the oncology subspecialty, so I did that as part of my program. So thank you for having me.
thank you, Ensa. How about Roxanne?
Sure. Hi, everyone. My name is Roxanne, and I was part of the 2021 cohort for the APR and FNP class. And let's see, I guess now I'm a NP or dual certified FNP and PMHNP.
Thank you. How about Jason?
Hi, can you hear me okay? There's a helicopter in the back.
Yeah, we can
I'm
hear
gonna get
you.
into that. Okay, great. I'm Jason. I graduated from UCLA. My bachelor's actually in sociology in 2020. Then I got my master's degree from the MECHAN program in 2023.
Thank you. Sana?
Hi everyone, I am Sanadi Sandu. I graduated in 2021 from UCLA from the FNP program, and ever since then I've been working in urgent care and family internal medicine. Thank you.
Great, thank you. How about you in the room, Jennifer?
Do I speak into there?
Oh, the microphone is over here.
Okay. Hi, everybody. My name is Jen. I am a graduate of the 2022 class, MSN FNP class. I'm working as a family nurse practitioner in internal medicine.
Thank you. Rachel.
Hi, everyone. I'm Rachel. I graduated from the Adult Geriatric Acute Care APRN program in 2021. And I work as a nurse practitioner-led patient advocate at a company that I launched called Noble Care.
Great, wonderful. Thank you for those introductions. We're gonna go ahead and get started with the meat and potatoes of the questions. So for the first question, how did the UCLA School of Nursing prepare you for your current career? Who would like to tackle that one?
I can go.
Go for it.
So one thing I think that set UCLA apart from other schools was that they provided the clinical experiences for us, so we didn't have to go and look for our clinical sites ourselves. And in doing that, I think they provided us with really well-rounded experiences, so that we can really build our foundation of practice upon that. And we, didn't have to spend so much time being stressed about where our next rotation was going to be. I think, I did a lot of time at, or a lot of my hours at the VA and at Planned Parenthood. And those are some experiences that I carry with me through my practice today. And I think that I'll still be building upon that in the future as well.
Thank you, Jennifer. Who else would like to weigh in?
I can just say a brief thing. Oh,
Go ahead, Roxanne.
sorry. All I wanted to say for UCLA specifically, I feel like, especially with any of the UC schools, they really focus on the research and critically appraising research, which I think is even more important now more than ever. And I think that has been extremely helpful in all of my roles as a professional.
Yeah, to piggyback off of that, the research and the courses that the advanced practice, and I'm sure the undergrad also offers or provides for the students is really, it's strong and unique. And I didn't have any plan to work in research or do any research after I wanted to be a clinician. I started as an oncology nurse And last year I was on maternity leave, going through a transition in my last job, and I found myself taking an going after an opportunity to write a manuscript through the Gerontological Advanced Practice Nurse Association that's being published as a case study next year. And I think it's just the confidence and the skills that I got from the program, specifically research, is what allowed me to just take that on and do it. So it's unique to UCLA.
Thank you. Anyone else?
I want to add to what you just said. In my particular case, I was a oncology nurse for many years when I started my master's program at UCLA. And one of the things that attracted me to the school was the fact that at the time I could do the adult nurse practitioner program with that subspecialty in oncology. And in 2002, when I was accepted to the school, there was only, I think, 4 or 5 schools in the nation that had such a specialty. So I really feel I was extremely prepared in my clinical curriculum for the practice that I wanted to then develop after I graduated as an oncology nurse practitioner in particular. So I was very proud and very thankful that I had a school just nearby, just 2 hours away. I could move to LA and pursue those studies. And to all you guys' point, the level of the academic rigor and research definitely, I think, sets the graduates apart.
Thank you. Anyone else would like to weigh in?
I would like to add that towards the end of any graduate course, I think UCLA has a really good like a class to just kind of guide you as to when you graduate, what all to look for when you're applying for jobs, how to negotiate for certain things, what to be okay with, what not to be okay with, which I think a lot of schools don't guide. At the same time, very much like we're having a meet right now, we had the same meeting when we were about to graduate to like, hear the other side, like what happens after. So I think that those are big pluses because right after you graduate, what all do you need to know? So.
Great, thank you. We're gonna go ahead and for the next question. What are the top 3 pieces of advice that you would give to a recent nursing grad to prepare for professional life? Top
Juan,
three
can you
pieces of advice.
specify a nursing grad, undergrad with a BSN or a graduate degree?
BSN or MECAN?
I think for both, when I was sitting in the seat, I got my nursing degree in the Midwest. That was 12 years ago, and I thought that was the first job I got was gonna just I had to crush it. I had to get the best hospital, the best position there. And like it just taking a step back, it's like first of all, what does the best mean? Like what are your goals? What are you trying to do as a nurse in the short term? And then it's a stepping stone. So like the statistics show that the likelihood of you staying in that job by the time you're done being a nurse is like so it's low. And so use it as a way as confidence to whatever comes next. And even if let's say that you want to be an ICU nurse, because I know like sitting in that seat, it was like that was the big thing, like being an ICU nurse for whatever reason. That's something that a lot of people are trying to chase. And it can be that maybe you start in the ICU, maybe you start somewhere else, but you don't know what you're gonna want to do next necessarily. You might think right now, but you have so much ahead of you for your career. So using the experience to gain confidence, skills, ask questions to like all the interdisciplinary team to learn more about what they do, who they are, is a way to figure out like what the next step is for you.
Thank you. Anybody else would like to add?
Yeah, I'd like to add on as someone who's only been a nurse for 2 years now. I think being curious, asking questions, and showing genuine interests in topics that you may not know about, I found to be very beneficial in terms of being able to develop strong relationships with nurses who know more than me and who are more senior than me, and gaining others' trust that you are trying to do your best. So I think even though you're done with school and you've technically graduated and you're done studying and all that, the amount of learning you do after school is going to be greater, much more than you do at school than you actually do on the floor. So just staying curious.
Stay curious. I like that.
Yeah.
I think
everyone-
Jason hit on something that's really important for students. I want to encourage anyone who's listening, just completing their BSN and just starting a nursing career. I think it's really important to have a few years of experience sort of in the trenches. I think we all have to earn those badges, which will help you as you move on into your graduate work. But Jason, you hit on something that I think is particularly even more important once you graduate as a nurse practitioner or a clinical nurse specialty in any advanced practice degree. I think the program prepared me and gave me a strong basis and foundation. But to your point, a lot of the learning takes place after once you're in that first job as an advanced practitioner. And I'm still very close friends with the oncologist who gave me my first opportunity and job in clinic. And he often kids with me and says, I trained you. And he's partly right. He did teach me a lot, but the school offered that strong foundation in order for me to be a curious learner and a safe learner, right? As we're just starting our practice.
Thank you. Anyone else?
For
I think
new
go
graduate
ahead.
practitioners, very much like Jason said, always be curious. And there are times when you feel like, oh, I don't know everything, which is normal. You don't have to know everything. Like confidence just comes from continuous learning, asking questions, reading up on stuff, going back to basics. Like you're always relearning things. So if you think I'll have to know everything, then I'll be ready. That's not going to build your confidence. So just know that you know enough and know what you don't know enough, and just go from there. Just be safe. But you'll always have enough resources at your disposal to just get it started, get it going. For first 3 to 6 months, you might feel like, oh my God, I don't know if I'm doing the right thing, which is normal too. But over time, you're just going to be running the show. So just be patient with yourself.
Thank you. For our next question, how did you decide what specialty to go into? Talking about your specialties.
Yeah, if I could answer first, I'd love to. But it was really funny at UCLA during my mechan program, in our peds curriculum, we maybe covered oncology for a day or two at most. And during my senior preceptorship selection course, I chose a random peds floor, and that was actually peds hematology oncology. I knew I wanted to work in peds, but I ended up on this floor, and I fell in love with the continuity of care I get to experience with patients and their families, because we do have patients that stay here for weeks and months at a time. But because I didn't learn too much of it in nursing school, it was a very steep learning curve. But I feel like nursing can have half of it might be medicine, but the other half of it is like this interpersonal relationship where you get to provide actual passionate care to patients where they feel like they're in safe hands at work. And I really do my best to embrace that. And I think I have the ability to best show that on a peds or a hematology oncology floor where I get to see these patients and families over and over.
Thank you, Jason. Who would like to go next?
I have a funny story. I always say that oncology found me. I didn't find oncology. When I graduated from nursing school, I think like many of us new graduates, you're just desperate to get a job because you need to start earning money. And I always wanted to practice in the OR. I thought the operating room was going to be very cool, very exciting, high intensity. And I thought that's where I want to be, in the operating room. It happens that when I went for my first job interviews just down the street at UC Irvine Medical Center, it was the oncology floor manager that was looking for nurses. So I interviewed with her, and she hired me and gave me a job. And I thought, well, I'll start working in the oncology floor, but I'm eventually going to work my way down to the bottom floor where the operating room is. And I think, to Jason's point, I just fell in love with the patients, the challenge, the high acuity of the care that we were giving. And then quickly started learning also about bone marrow and stem cell transplant. And I never left. So I'm still trying to find out how I make my way to the operating room at this point.
Mm,
I can kind of speak to the APRN students. So I'm working in primary care, and that was something that was always interesting to me, was to provide longitudinal care versus something more acute. And being able to treat patients and families over the years and getting to know them and build those relationships is really important to me. And so that's how I ended up in primary care, and I intend to stay there.
very cool.
I I think, yeah, just to add on, I think initially I started in an inpatient oncology unit in at Northwestern in Chicago, and I'm trying to remember how I actually ended up on the surge onc unit. But I think that also just speaks to like you don't have to know, you have to like lean into what your interests are and like let that kind of guide you to the first job, whether it's something happens to be open on the unit or you think you like something. I remember liking that oncology was something that you couldn't fix, but you could stay by the patient's side and help them manage their symptoms and support them, and it felt like a holistic way of nursing that I was drawn to. So I think not knowing the exact specialty even or is a way to keep the doors open for yourself and explore what is available and to see what that leads to next.
Anyone else? We'll move to the next question. How would you describe your work-life balance as a nurse? Work-life balance as a nurse, how would you describe that?
I would want to say that you should have that as your priority. I know when you're new, you're like, oh, I'm gonna overstretch myself. I'm not gonna say no. I'm gonna pick up extra stuff. Don't do that. Trust me, don't do that. Just whichever floor you're working on, just do your best. And yeah, sure, if you need to work extra, go ahead and do that. Now, this is for RNs, but for APRNs, I would say when you're new, your charts it would probably take forever to complete stuff, but just follow the style that works for you. Just make a point of like not leaving anything pending before we leave. Also, don't overstay 2-3 hours just because it's not worth it. But try to like gain your speed. Just, eventually you'll get the hang of it, but make sure that you're taking enough time for yourself. It's very important. Otherwise, 2 years down the lane max, you'll feel the burnout and you wouldn't even want to work. So don't put yourself through that. And what I do personally is that I work in 2 different specialties. So I have my days divided, but I always take weekends off. And I make sure every quarter I'm trying to go on a trip just to kind of forget who I
Oh,
am and
nice.
restart it. Thank
Very
you.
cool.
I love that. I think that's so, I mean, I think that could be, I guess, speaking for myself, like why I wanted to come today. And, I'm excited about my work. I like what I do. I um, have been kind of, in a various settings. As I said, I was oncology, then critical care and ICU for 5 years. And then I have two young kids, a 1.5 and a 3.5-year-old. And now I've started this business, the nurse practitioner led patient advocacy, to bridge between doctor visit or provider visit care, really. And it is offering in this chapter, more of the flexibility to see patients in their home, work from home, do virtual care. And so I think it like the experience for me highlights like the versatility of nursing as a whole for RNs and APRNs, just that there is so much you can do, like maybe certain seasons of it, you are grinding more and you are like getting the badge, to like really prove it to yourself and you know, I think just allowing like maybe certain times where you're working a lot and then like reflecting back on, is this really what I want? Or now do I feel like I have a lot of skills and can reassess what I'm really passionate about, or maybe not passionate about, but have more of an interest in that I didn't think I had before. So just stay, like we've said, it's been mentioned, stay curious and open, and that will lead to more opportunities.
Thank you. Anyone else? For the next question, what does a typical day look like for you as a nurse in the field?
Well, maybe I'll answer that since I've pivoted in the last 7 years of my career from clinical practice into pharma and industry as a breast cancer medical science liaison. So my typical day could be traveling from Austin to Houston and meeting with researchers and oncologists at MD Anderson or Baylor College of Medicine in Houston and discussing trials that they have with us, gaps in the studies and data points. Perhaps they may have ideas or suggestions of studies, and then gathering those insights, those conversations with them, and then bringing them back to our company and our developers here at AstraZeneca, which is where I work, and guiding some of the studies and trials that we have. So that's what sometimes a typical day for me looks like. Also, I'm the lead for a clinical trial for breast cancer for triple negative patients. It's a global study. So discussing with my global team how to increase patient accrual, how to make facilities and the community aware of the trial. We're very, very driven to increase accrual of minority patients into our clinical trials to make sure those patients are counted into the data. So that's what a typical day looks like for me now that I've transitioned into more of a clinical research in pharmaceutical industries.
Anyone else?
So I kind of giggled when the question was asked because I looked back at like my first job as a new grad RN, and I would think that like my typical day started with probably me crying in the car a little bit before starting my 12-hour shift, and then I would go and do my shift and then come back and cry a little bit more in the car and then go home. But but that feeling goes away as the time goes on, and I would say we talked about it already a while. So, but I think it takes like maybe about a year to get your footing when, you don't feel like you have to have those days. And then, I practiced as an RN and, those days became few and far in between. Typically now as an NP, I'm working Monday through Friday, 9 to 5. My commute is it's like 6 minutes away from my house. It's very nice. I see maybe between 13 and 16 patients in a day. I get some time for admin work and then, close up my charts and go home. So it's a very much a different pace from looking at an RN. But that being said, I wouldn't have changed any of my RN experience for even as difficult as it was.
Thank you for that.
I just want to ask you a question. Don't you feel that that RN experience was pivotal and important in making sure you felt confident in your practice as a nurse practitioner later on?
Oh yeah, definitely. Like I said, I wouldn't have changed it at all. And I think it definitely built me into the provider that I am now. And it makes me a lot more empathetic for new nurses and new NPs, and a lot more patient for not only them, but also the patients themselves, my support staff, and everybody around. And I think it's unfortunately just kind of something that everybody has to go through. Maybe not to that extent that they felt so crying and depressed like I did. But you know, it's like a rigorous field, and that's just kind of how it is, and it makes you into a better person and a better provider. So yeah,
We've all gone into the closet or the empty rooms
yeah,
to cry.
the Pyxis room, yeah.
Yeah.
Yeah, I mean, I have that same similar stories of like first I don't know, I can remember the first 6 months of just constantly feeling uh scared, nervous, not confident, and it was just like, when is this going to end? And like asking questions and like confiding in other nurses, even if they were more senior. Sometimes that was more helpful because I could see how confident they were and that they were a charge nurse. And I would look at them with such big eyes and like think, how could that happen? And then a year and a half later, I was charge nurse. And it doesn't matter. Like the point is, like, you can't even imagine yourself being in that role when you first start, and then you're like running the unit. And it can happen like because you volunteer to do it or because you're sort of voluntold to do it. And at some point you get there. And so I think like I wish I had known that sitting in your seat, that like it's totally normal and okay to be scared. And like, I mean, even like putting tubing in the like bag, I was like, am I poking it in right? I mean, such things that you just become so like second nature, and you like do it while you're talking and doing five other things, like so it's just normal to feel so uh small at first, and just use your people around you to get bigger and feel better.
Great, wonderful. Anyone else would like to weigh in on this one?
I would like to add, when as in when I did work in the hospital on, DOU or ICU floor, your typical day is usually you show up, you get your report, you check up on your patients, you start with the meds. If there's something not right, you obviously then that can change quickly. You might have a plan for your shift, but if you have to call a rapid or a code, that might throw you off. And just know that's normal. If you need some time after that, reach out to your charge nurse. And then you might have rounds with your attending physician, and then you do have your lunch breaks, which is usually 30 minutes typically in the hospital setting. And then as the day goes on, just know that things calm down, most of the diagnostic testings are done, and then you start to prep for the next shift to come in, to have close everything and know that now you're going to give a hand off. If you miss something, that's okay. Make sure you let the next staff know so it doesn't slip through. And as an NP, it depends which setting you work on. Like for me, urgent care can vary because you don't know how many patients are coming in. So you just have to still be really fast paced, think, right then and there, do your exam, come up with a diagnosis, treatment right then and there. And as far as, if you are in a family nurse practitioner or internal medicine where you go to a clinic, typically you start at 8, and you have your appointments lined up, which would be different for everybody. But for me, it's usually kind of close to 20. And I try to complete all my charts, and then you're done by 5. So that's all.
Thank you for that. For our next question, What are some of the most important skills in your role, and how did you learn these skills?
I can tell you, Juan, that one of the most important skills I use every day working now as a medical science liaison is collaboration. And I can tell you that I developed that as an RN and as an MP because we all remember on the floor you have to collaborate and work with your nursing assistants, your transport staff, the lab tech, the physicians, the residents, the fellows. So it takes a whole team and village to take care of some of these very complex patients. So I think that is a skill that has been transferable now into industry in the role that I do right now. Is collaborating with different teams and different groups of people in order to accomplish the same goal.
Yeah, I'd like to kind of piggyback off what Enza just said. I think communication is important in many professions, but however, in nursing, I think they we oftentimes emphasize closed loop communication, meaning you make sure that there's closure to the conversation, whether it might be what lab might be drawn at what time or what patient may get transferred what floor. But overall, I think having clear communication with whatever team members you may be working with and identifying the goal and if you have met that or not, and what is the next step if it is not your responsibility to carry out that next step. So communication can come in that way. It can also come in asking for help, delegating your tasks as a bedside nurse to the NA or whoever else may be there. You can't be too communicative, I think, especially when it comes to taking care of patients whose lives are kind of in your hands. So I'd say communication is a very important skill. And I think the way I kind of try to approach my communication is you can't really be too safe as a nurse. You want to be as safe as you can when you're taking care of patients. So over communicating, I don't know if can really be a bad thing. So I try to just communicate everything that's on my table that I think is important to share to others. Yeah, I think that's what I have to share. However, I do have to go back to the floor now. I'm on my lunch break. The onc nurses here might know, but I have a CAR T infusion to give scheduled. So got to go pre-med and take the vitals and everything. But I
Good
appreciate
luck with that, Jason. Good
thank
luck.
you.
I
I
Thank you,
hope you
appreciate
have those
Jason.
everyone's time.
CRS.
Hope I could speak at this again. Well, hope you guys have a great rest of your panel.
Bye,
Thank
Jason.
you.
Thank you.
Bye-bye.
Alrighty. For our next question, what are some red or green flags that you look for in an MP job?
Oof. I feel like I'll just add my little 2 cents on that is a red flag is if they're not quite sure what your role is going to be. I mean, that could be a red or an orange flag, I guess, but it could be an opportunity for any APRN to shape the role, but it could also kind of mean that there might be some organization issues. Also, another red flag maybe is to kind of identify what their incentive process is. Sometimes when they're operating on these RVUs and it's strictly on that, it's oftentimes I feel like it's about how many patients you see versus the quality of care that you give for each patient. So that's something I kind of ask about, like how many patients do you expect for me to see in a day kind of thing.
Yeah.
I would also say if there's not a very structured orientation process, that's kind of a red flag. And they should be able to tell you upfront the time frame for you to be fully on your own and seeing a full load of patients. That and if the clinic is not clear with you about if you ask what the NP turnover rate is and they're kind of try to dance around the answer, I would say that's another red flag. Other than that, they should always be giving you, a really clear contract so that you know exactly how like Roxanne said, what your incentive package is and how your pay works.
Anyone else? Red and green flags.
I think another important thing to look at when you're considering a job too is how easy it is or not to contact and work with that physician colleague, right? Because I have been in instances where it's been extremely difficult to get a hold of somebody and you need to politically consult a case with somebody. So I think discussing that and maybe perhaps if there are other APRNs in the site, just getting a feel from them how easy or not it is to get a hold of somebody when you really need to.
I think maybe not so much a green flag, but a way to get a, information about the job is even though this is like putting yourself out there, like finding other employees that work there to talk to is really worthwhile because that's how you're going to really know what's going on the unit or wherever it is that you're working. You're going to get more information that way. So it might feel like it's scary to do that, but it will give you a lot of information.
Moving on to our next question. What advice do you have for students who are looking to go into your specialty? Advice for students who are looking to go into your specialty. Who would like to jump in?
I want to jump in because I feel like psych is a big thing right now, especially psych NPs. And I would say that to become a psych NP or maybe even psychiatric nurse in general, to really get experience in this specialty, but also have a passion for it. It's psychiatric care is extremely difficult. It's a very relatively new specialty. There's a lot that we don't know with, and most of the knowledge that we have as far as psychiatry goes is a very theoretical foundation. And so it relies a lot on, a solid kind of clinical foundation, but also a genuine curiosity and care about psychiatric mental health or psychiatry and mental health.
Anyone else would like to jump in on this one?
I think for independent practice, I would say really know what the rules are, what are the laws, about malpractice, so this is really more speaking to the APRNs and getting experience in other settings before it. And if it's something that you see yourself doing, it's in California, there was a bill that was passed in January of 2026 there's a part 103, 104. 103 is practicing independently with SPs, and 104 is actually being able to practice, prescribe, and recommend and really be an independent practitioner after 9,200 hours. And so there's like a lot to it, but the fact that we can do that is pretty cool. So there's been a lot of changes for nurse practitioners that allow for us to be able to reach patients in a way that you're not confined to certain settings or with physicians or other NPs with their 104. You can kind of create your own wheel, which is again like the versatility in the nursing field is really cool.
I just want to add to any new nurse listening or joining right now. I think independent of what subspecialty you want to go into, whether it's oncology or acute care, ICU. It's really finding mentors. Try to find mentors or someone that you could reach out to perhaps confide and guide you in your career path that you could always come back to for advice or even sponsorship sometimes. Sometimes depending on where you practice and the setting or the hospital, it might be difficult to transfer from one unit or specialty to another without the support and sponsorship of someone more senior. So always look for a sponsor or someone that can help you along the way.
That's great advice right there.
I'll just quickly add too, that UCLA provides such a great clinical experience. And I think that if you treat every experience and every day that you're on a clinical site like a job interview, it will open up doors for you. Even if you're not particularly interested in the specialty that you're rotating in, for example, just just act as if you're very interested and treat every clinical day like a job interview. Because for example, after NP school, I was hired into a clinic that I had one or I think 2 or 3 rotations at, and it was because I had such a good relationship with the supervising physician at that clinic. And so that door opened up to me because during NP school, I was curious and I was excited to learn every day, even if it didn't seem like that was the place that I wanted to work in after NP school. So, and you build relationships that way. And so even if you won't necessarily find yourself working for that preceptor, maybe that preceptor knows somebody in the specialty that you want to go into and can put in a good word for you. So really important for you students who are still going through the rotations to always put your best foot forward so that that opportunity is always there for you and you don't burn any bridges while you're going through your rotations.
100%. I echo everything you said. Yes.
Other skills that I would say come in pretty handy is let's say whatever specialty you've decided to go or work in, read up on the routine stuff. Let's say for family medicine, it would be long-term illnesses. So just read up so you know, and then stay up to date on the guidelines. And screenings, stay up to date on screenings. Like you should know what your flow is like, what you're going to see every day. Be well versed with that. And also make sure to ask questions. Like whosoever is there to help you out, don't hesitate. If you're not sure, trust me, everyone would be willing to help you out. Like nobody's going to say, oh, I don't have time. I don't have time to help you. Most of the people would be like, okay, yeah, what happened? Let's talk about it. And so use that as a skill, just like, or reach out to, network. So if you're having events with other companies, make sure you go and attend, put yourself out there and network, and then, share contacts, because you don't know when you're going to need them. Like I have like a list of cardiologists, urologists, like anyone that I can text and connect with. And sometimes you can get the care started, before they even see the specialty or like a consult. So just be confident enough to make sure that it's okay, you can reach out, so that helps. Stay curious. And also is don't dismiss your patients. So if you started them on something and they're coming back with the same complaint, try to dig deeper. Like, okay, what did I miss? is it possible I could have missed something? So make sure to, review everything, or did someone else miss something? So that's something that comes in handy. And know your resources. Now we have open evidence, which is obviously AI based. So you can actually, everything based on recommendations, guidelines, research shows up. So use that. Obviously you have your books. So I would say know your resources. That comes in handy.
Thank you. For our next question is, what populations do you work with, and why did you choose to work with these populations?
I can start. I work for an FQHC, and I feel really inspired to help, people who don't know, to advocate for them. And also urgent care, many times I see patients who don't have insurances or who've never seen a PCP all their life. So I like it because I'm there for them, and then I want to make sure once they leave, they know what to do next, so they're not lost in the healthcare system. So I'm very passionate about helping people who don't have the resources, nobody guided them, and to be that bridge and to help them out. So especially the underserved population.
I think that's where where we have the most power, I feel, especially as nurse practitioners. We tend to, this is just a generalization, but I feel like we tend to have this draw towards underserved communities, and then especially communities with intersectionality. And, for me, currently my primary base is with veterans who are unhoused. And so, and it is a very challenging population, but it is extremely rewarding when you find some progress, or at least you're able to establish like a good therapeutic alliance, and then get buy-in for something very simple like, okay, let's work on your sleep, for example. Prior to this, as an FNP, I was working with, again, underserved populations, and then primarily Spanish speaking, in which just because the necessity of the job, it required me to learn Spanish. And, I then progressed and went over to South Texas, actually, to practice for a little bit as an FNP. And it's just such a rewarding experience to be able to provide really the basics of like giving psychoeducation or just health education in general, and then advocating for, people that we see every day, we interact with every day. They're our families, they're our friends. And so, yeah.
Anyone else?
What you're doing is really amazing.
I didn't hear. What did you say, Sana? I didn't hear you.
Roxanne, what you're doing is really, really amazing. You should
Oh, yeah. Yeah.
so proud of yourself.
Thank you.
Yes.
And we're nearing the end of the hour, so we're gonna go ahead and ask our final question. And I want you guys to take a moment to think about your time here at your School of Nursing, interacting with their faculty, with your peers, and pretty much what does all that mean to you? What does it mean to you to be a Bruin nurse? What can you tell us?
Well, UCLA set us up for success. And anytime it is a name tag. So anywhere you go, you mention your UCLA grad, they have this faith that, oh, you probably know better. Like you're probably trained better than everyone out there. So, and we've been very fortunate to have the best faculty, the best trainings, very good program, and enough guidance to like, okay, how do we navigate our life after this? So it's like a whole package. It can't get better than that. So thank you so much.
Thank you, Sana.
Yeah, I mean, like you were saying, the name holds so strong, and I feel that more in the role that I'm in right now, more than any point in my nursing journey. I'm a function as a clinical consultant, as an advocate, without my 103 and 104, I'm not practicing independently. So having that, the weight of UCLA NP and just the education, my lens through an acute care, adult geriatric all of it is so powerful because it shows that I'm well educated, well trained, the research, the confidence with that, being able to just pick up, a script and work on it and then turn it into a piece that's being published. It's like that comes from the school. I keep coming back to that. I mean, every day I think about it because it's constant. It's, oh, you're UCLA NP. Okay, so you it's just this automatic like and nurse, UCLA nurse, right? It's just the name gives you so much more than you realize sitting in your seat until later. So just remember that it's the education and training that you're getting that sets you apart.
Thank you for that.
Yeah, right. It's the reputation that comes with the school. And I've sensed that when applying for jobs or discussing my training with people, when you tell them that you graduated from UCLA, there's a certain expectation they have of you, and I think we have of ourselves. So yeah, feel very fortunate to have had the opportunity and the privilege to have trained where I did. And I carry that with me. And here in Texas, I'm very proud to have my UCLA alumni plate cover in my car.
Oh, nice.
So very, very proud Bruin.
Totally agree with all of that. And not only do I think employers look at you differently if you're from UCLA, the patients also sometimes
Mhm.
will ask, where were you trained? And I get to say I was trained at UCLA, and it carries a lot of weight. And so I've become somewhat of an incessant UCLA fan. I think after this, I'll just go stop over at the store and buy some more UCLA things as well. But more than that, also is I'm in a place where I'm hiring other NPs, and if I see somebody come across my desk with a UCLA degree, it stands out to me more so than I think any other school, because I know that they come prepared with the very best training, the very best didactic courses. They were taught by the very best faculty, and I just put so much weight and comfort in their preparation to become an NP.
Oh, I guess. Has everyone gone? Oh, what it means to be a Bruin nurse. So I think for me, especially also having worked at UCLA as an RN, I feel like being a Bruin nurse is someone that is research trained and is able to integrate this in a meaningful way. I think that we're very collaborative, as everyone kind of had mentioned. Communication is really big. It also, I think during our training at UCLA, there was always these kind of mixers where we get to talk to other specialties and disciplines. And that is still true, being a provider, just being a nurse in general. And yeah, I think I emphasize this research base because I feel like I was almost traumatized by a research class, but it's just been, I think of those classes and those professors constantly. They inspire me. They really laid out the foundation for me to allow me to dig into my curiosities, to be a little bit more objective when I'm looking at things and not to silo myself in any one way of thinking. So I think that's what it means to be a Bruin nurse.
Roxanne, you also have PTSD from stats.
PTSD from a lot of things, but it was good. It was good.
Yeah.
I'll just quickly add too that I'm really proud that UCLA has somewhat of a a social justice component in the curriculum. And so we got to take classes that included focus on incarcerated people, on Indigenous people. And that's really important to me and something I always think about, that I don't think that is offered at many other schools.
Any final thoughts?
I just had a final thought because I know this is on everyone's radar as a student, as an RN, as an NP, is managing burnout. And it's very easy, especially because we are so passionate about what we're doing, to allow the systems to kind of take us into this space of burnout. And so I often wonder, I think this next generation of professionals have it a little better, have a better grasp of kind of self-care, but more importantly is that the kind of knowing your values as a nurse, whether that be, you know, knowledge attainment, leadership, health equity. I think that's super important to be your kind of compass in avoiding burnout, because you still kind of remain that sense of purpose. And then also establishing your support system wherever you go. I think that's going to be super helpful.
Alrighty, and with that, we're gonna go ahead and close out. Thank you, Ensa, Rachel, Jennifer, Roxanne, Jason, and Sana. Thank you for joining us today. It's been a pleasure. Thank you for your time.
Thanks for the invitation.
Bye, thank you.
Bye-bye.
Thank you so much.